think at this point, we're going to move to our patient presentation, and we will have two presenters. Very excited to hear their reflections on innovations in care and research. And so I think we'll be hearing from Funmi Desaloyu and then G. Ida Omur.
Thank you. Hi, everyone. My name's Funmi. I'm from the UK and I have sickle cell disease, so HBSS. I'll be doing this presentation with Eda, who will shortly take over. But before we get started, I would just like to thank ASCAT and EuroBloodNet for giving us, the patients, this opportunity to be part of this conference. So if we just start off with the first slide and this quotation from Eda that says, "We can't do this without you and you can't do this without us." So essentially, I feel that that quotation basically just sums up our collaboration and the need for both you guys as clinicians and us as patients to be involved. And it just sums up what we've tried to do with the patient session. So very much the session this year brought together a group of clinicians last year who came together from across the world and really supported patients to engage in a meaningful way, thinking about how can we collaborate in a way that influences research, and how can we think about ways that we can improve care and treatment for individuals living with sickle cell anemia and or thalassaemia. So it was really a case of the clinicians coming together to support us in this way. As a result, last year, we were able to develop a list of top 10 questions, which we then presented at last year's ASCAT Plenary Session. So those questions really focused on areas where we would like you as the clinicians to do further research in. So moving on to this year. So unfortunately, due to COVID, we were not able to meet in person, but thankfully we were still able to connect online and have discussions. So this year we were a group of 49 patients, carers, parents, patient representatives that gathered pretty much from across the world. So the list just details how many people were from each country. We had patients, we had 38 countries represented within Europe. We also had 13 experts that comprised of physicians, nurses, psychologists, and we had representation also from EuroBloodNet. So we found that because this year we gathered virtually, it gave us the opportunity for greater patient participation. So this slide just shows is basically a screenshot of all of us on the various Zoom meetings that have happened over this week. So the key features from the patient workshop. So like I was saying earlier on, this session really built on the legacy and the strong foundations that was laid last year at the 2019 conference. We were supported by moderators who were healthcare professionals who worked alongside us as people, patients who have the conditions. We focused specifically on topics that we had identified as areas where further research is needed as per last year's conference. And we also were able to prioritize topics through a EuroBloodNet survey that we completed beforehand. There was a session where we met the experts, so that gave us as patients the opportunity to meet the medical professionals and also acknowledge that we as patients are experts in our own right as we live and manage the condition on a day-to-day basis. So everyone who participated, both the patients, the professionals, parents, carers, had an opportunity to ask questions within the meeting. So that was either live or via the chat on Zoom. And the sessions basically comprised of pre-recorded presentations as well as live elements. So the next slide, day one. So that was Monday. We focused on 3 specific themes. So number 1 was COVID. We talked about the peer review session, and we also talked about research was another topic that we focused on. And all three topics kind of had the same format, where we listened to testimonies from different people from different countries, and then it was then followed by a live Q&A session. So if we firstly talk about the COVID session and the outcome. So what was very evident is that the experience varied based on the country that we were in. So in the UK, right from the beginning, we were told that we needed to shield. So this was a directive from the UK government that was mandatory, which basically meant that if you had sickle cell disease, you couldn't leave your house for under any circumstances, not to get food, not to get medication, not to exercise. So basically house arrest in another term. So that was what we had to do in the UK, but that wasn't mandatory for some of our counterparts in other European countries. So our experiences differed on that level. Also, the quality of care that we experienced during this pandemic period really varied between countries. So, for example, we had a testimony from someone who was in the UK who got admitted due to a crisis and said that, you know, during this period, they experienced the best treatment ever. They were admitted to the correct hematology ward. They got person-centered specific care. They had rapid assessment upon admission. They had direct access to their clinicians and medical teams. That was contrasted with someone else from a European country who said that they attended the emergency room and had to wait 6 hours in the ED to get their COVID swab. So our experiences really did differ depending on where we were in the world. What we were able to reach a consensus around was because us in the UK, we were on the list, classed as people who were extremely vulnerable to severe COVID should we catch it. There was wide recognition amongst employers, amongst colleagues, friends, family, even the government, that actually, you know, sickle cell is serious. So for us, we felt that finally it was very validating for us that, you know, finally the seriousness of our condition was finally being recognized and brought to the forefront of people's awareness, which previously wasn't the case. Fear and anxiety were commonplace and was a common thread throughout all of the experiences that we listened to. The use of telehealth, so telemed, telecare, was something that featured also heavily throughout this experience. So people attending clinics electronically, having virtual conversations with their physicians online. So that was something that we all felt was a good thing and allowed us to have greater access to care and treatment, and is something that we think should be a lasting legacy, if anything positive, from this pandemic. Lastly, we talked about the role of social media. So how did we stay informed? How did we access information? How did we work out what sources of information to trust and where to get it from? So that was a summary of our COVID session. Moving swiftly on to the peer review session. So this session really focused on what is peer reviews. So in the UK, it's a UK system where basically we assess services, we assess the quality of services that are being delivered to patients with sickle cell disease. So it basically has patients are included within a group of people who go and assess healthcare services. So for example, a group from London might go and assess a hospital that, for example, was in Manchester, and kind of look at the quality of the service that's being provided to people. And it includes patients as part of that group of people who go along. We have access to the documents, speak to healthcare professionals and individuals who live in the area and actually use the service to get a view of the kind of quality of care that people are experiencing. We listened to two video testimonies from patients who had actually been part of the peer review process. And what transpired is that actually very few of us knew about peer reviews. So very few of us actually understood the process or had an awareness of what actually the peer review process involved. As a result, we then talked about, okay, so how can we increase the number of patients who participate in the peer review process, and how can we ensure that peer review is something that's not just limited to the UK, but also takes place in other European countries. We thought about the role that EuroBloodNet can play in kind of disseminating the work that is done by the peer review process. We also thought about how do we do this in other places. We really like the fact that the peer review process is a way of holding stakeholders accountable. So, you know, our services delivering the care that they're commissioned to provide, so on and so forth. The key messages were, how do we share good practice that emerges from the peer review? How do we ensure that there is a consistent approach, not just in the UK, but across the European countries and also across the world? What can we do to advertise the peer review process amongst us as a patient group? Lastly, we talked about very key point is we have this system in place as a way of quality assessing services, but why do people still not get good care was a question that was raised. And through the support of the clinicians who were also in the session, we were able to kind of understand that it's an issue of resource. So everyone has good intentions at heart. Everyone wants to essentially make sure that, you know, we get the best care and treatment, but it often comes down to limited resources. So moving swiftly on to the last section, so why I took part in research. So this really was an opportunity to listen to 4 people's experiences of taking part in research. So one of which was bone marrow transplantation, a new drug, old drug, telephone questionnaire. And the overarching aim that came forward was really for us as patients who take part in research, there is quite a heavy emotional and psychological toll that is on us when we participate. And this was a surprise to clinicians who were in the sessions with us. So it made them think about, okay, so going forward, how can we make things better for us patients who participate in research? We thought a bit about, okay, how do we spread awareness? How do we get patients to take part? How do us as patients, how are we told? How are we involved in opportunities to participate? We thought about countries where research is taking place, but there's poor access. So for example, London's a place where there's quite a number of people who have sickle cell. So you have large centres, you have access to research, whereas maybe another part of the UK, so for example, Wales may have a smaller number of people, therefore not have the same sort of access to research opportunities. We then thought about countries like India and Africa, where there may be little or no research happening. People really struggled with the idea of a placebo. So, you know, you're taking a drug, is it working? Is it not working? And then that kind of toll, again, that heavy emotional toll, and psychological toll on us as patients. The 2 main problems we identified is there's very few clinical trials involving children, and also mental health as an area is a particular area where greater research is needed, specifically relating to the mental health struggles and difficulties that patients with sickle cell and or thalassaemia have. So I will now hand over to Ada, who will take you through the rest of the work we did. Thank you for your time.
Yes. Thank you from me. I'm Edda, also a sickle cell patient, type SS. So getting to the slide, because we don't have much time left. The experience with the medical expert session was that there was not enough time for people to ask all their questions. So a lot of questions remained unanswered. As an outcome of this, the EuroBloodNet want to start some seminars. Through the questions asked, we were able to learn what kind of topics were important for the patients. EuroBloodNet's aim is to make this seminar widely available to everyone through the use of subtitles and translating to other languages. So the next slide, please. Thank you. So there was also a session where the young people were able to meet with adults. The young people were able to educate themselves by asking them questions. You can see on the slide which adults they met within the age range 40 and 60. I will let you take a look for a second. So the next slide, please. So in this session with adults, there were 3 questions which stood out. The first question was about what they would change in their lives. The answers to this question included sports, getting a bone marrow transplant, and even change to a better jaw. Another question was about the most important problem the adults dealt with in their life, which related to being fatigued and finding ways to cope with it. So the third question was about mental health. Being a child or an adult with sickle cell disease is always hard for the mental. You feel like a burden. As a patient, you really need to have some help with the mental part, like we talked about already, just like the parents of a sickle cell patient. Next slide, please. The teenagers had more questions about other topics, which you can read on the slides. Next, please. So what's the best way for a doctor to communicate with the patient in the middle of a crisis? As a patient, we know our body the best through the years. So it is important for the doctors to believe us instead of just looking at the data. So like we started, we, the patients, can't do this without you, the doctors, and you can't do this without us. Next slide, please. The patients are asked for their opinions on what they take into consideration when deciding on a new treatment. The general consensus was in relation to the ratio of the risks versus the benefits. Next, please. The group were asked about what better ways could the doctors communicate with them. So you can see also the slide for the outcome. And there was also a topic about about how others refer to us. There were really strong opinions about that, which you could read. Yes, there. And next one, yeah. And the biggest discussion was in relation to tackling racism and stigma during our care. We need to start educating society about sickle cell disease. If society knows about us, the doctors and students have no reason to not know more about us. So if we are educated about sickle cell disease, it would clear the clouds about skin color and also reduce stigmatization and racism. Yes. So although people experiencing sickle cell disease on different levels, there certainly are a list of similar factors that impact us all in the same way. There were commonalities about pain despite the geographical differences, like we can see on the slide. So from Canada, they say dealing with limitations, pain, and setbacks. And from Africa, they also say we need more research to stop pain. Next. So I leave you with the final key messages. You can read them. And of course, thank you all for your participations. Are there any questions?
Thank you so much to the both of you. Gosh, that was definitely an amazing way to come to the end of the session, and such important things you both have spoken about. So thank you so much for that. So there are lots of things I was thinking about as I was going through, you know, what you both were talking about, and lots of things as a clinician, as a psychologist, you know, supporting children and young people with emotional well-being. That, you know, that's something I'm very interested in, thinking about stigma and racism as well. And so I guess one of the things I was thinking about especially was around research, and I was quite interested to hear that actually that's a big area where you know, patients are asking for support in helping them to, you know, go through a trial. So that's something I just wanted to draw upon in terms of, I found that fascinating to hear about. So thank you for sharing that. With questions, Dr. Rose, do you have anything to start off with?
For let's see, I just wanted to make someone wanted to know about participating in the workshops. So I don't know if you can give them some information about that, and then yeah, I would love to ask you both a question after that.
Okay, sure. So participation in the workshop. So essentially, it was a range of participation. So you had patients, you had family, you had carers, parents, patient organization representation, and essentially the sessions were structured, so followed specific themes, and then were just moderated by the clinicians and the moderators involved. And then there was an opportunity to ask questions, and there were so many questions, not enough time to answer all of the questions, but yeah, essentially that was the layout of the workshop sessions. Edda, do you have anything to add?
No, I think you made that very clear. Yeah.
So my question is, as we leave today, you know, you gave us such great information. I mean, I was writing things down like listen, believe, follow, and ask, and, you know, clear the clouds, have that transparent, clear information. If you could give us a final take home, one thing you want us to resonate on and, you know, think about as we leave this conference experience this year in 2020, from both of you, what is one final word or final thing we should think about?
Maybe I think the most important of all is sickle cell. We as a sickle cell disease patients are such a, and I know I don't talk only for myself. We are such a warriors, and you can't see anything about the outside. And if we put a makeup on or and dress and go outside, and people see us and they look at us and think, okay, so you're a sickle cell disease patient, and what's that, first of all? Second of all, okay, but I can't see anything about you. So it isn't actually that worse, I think. So with that, and now with COVID-19 going on, and in every country dealing with it on its own way, it's so hard as a patient to, actually to let them hear your voice. I'm drowning from all the other important patients that goes first, and they know more about them, and they are getting more security, or if I can say it that way. In Holland here, I literally come as last. Yeah.
Thank you very much, Edda. Thank you.
I think for me, I would say, firstly, you guys as clinicians, as professionals, as expert within the hemoglobinopathy field, I would say, first and foremost, keep listening to your patients. Secondly, I think in view of the pandemic and COVID, mental health specifically within our patient population group, I think that's an area that has been massively overlooked. And I think finally the light is shining on it. So I think as professionals, you work in multidisciplinary teams, I think to think collaboratively, how can you better support your patients who have sickle cell disease and thalassaemia with their mental health? And I guess lastly, it would be to remember that we are not patients only. We are people living with the condition, who have lives, families, jobs, careers, who want to live normal lives in inverted commas, like you and anyone else, really. So I guess that's my 3 take homes. I know you said 1, but yeah.
That is fine that you gave us 3. That's okay. We really appreciate it. And we appreciate you both so much coming and sharing your insights and the experiences from the workshop.
All right. Thank you for the opportunity.
Yes, thank you. It means a lot.